Hi, everyone. My name's Dan Friend. I'm a senior researcher at Mathematica in the Chicago office, and I am also the lead researcher on the PACT Pathways to Outcomes model that we'll be discussing today. Thank you very much for taking time out of your day and joining us. Just some quick roadmap to where we're going today. I'll introduce you all to some others on the call, and we'll get started talking about the PACT project and some of the motivation behind the models, and then we'll provide a high-level overview of our methods, and then we'll discuss the models themselves, and then we'll have time for Q&A and some discussion at the end. Face it, my name is Dan Friend. I want to also thank my many other co-authors on developing these models. It was truly a collaborative process, so I want to introduce everyone to Scott Baumgartner. He was a co-author and is going to be helping me out in the QA section. Heather Zaveri from Mathematica is our PACT project director. She is also on the call. And I want to thank those who are not on the call, Pam Holcomb, Elizabeth Clary, and Amy Overcash, who all helped develop these. And of course, we had lots of feedback and collaboration with our project officers, Kriti Jen and Kathleen McCoy, and I'll turn it over to Kriti right now to make some opening remarks. Kriti?
Sure. Thank you so much, Dan. It was a great introduction. Hi, everyone. My name is Kriti Jen, and on behalf of the Administration for Children and Families, I'd like to welcome you to this webinar. We know that you all have a lot going on these days, and we're really grateful that you made the time to come to this webinar. The PACT team and I, as Dan mentioned, are really excited to share the results of this challenging but productive process that unfolded over the last couple of years with all of you. It represents a lot of hard work, and we hope that you find it interesting as well as helpful for you as you think through your programs. Please note also that we're recording this webinar and plan to make it available for future viewing or for sharing with your colleagues as well. Thank you so much, Dan.
Great. All right, well, let's get started into the meat of things. I'll start off and tell you a little bit about PACT and tell you the reasons why we developed these 3 pathways to outcomes models we'll talk about today. And I should note we have a report that gives a full detail of all our methods and rationale and discusses the model in depth. That's available now, and I'll provide you the link to that report at the end of the presentation. But we also have a shorter brief that's forthcoming, should be published very soon. We provide the reference to that, but that's not available as of yet. So keep your questions coming as I go along, and I'm happy to provide more in-depth detail based on that published report at the end of our presentation today. So PACT stands for the Parents and Children Together Evaluation, and this is a multi-component study of family strength programs funded by ACF, namely Responsible Fatherhood, or RF programs, or Healthy Marriage and Relationship Education programs that we abbreviate HMRE. So Responsible Fatherhood programs in PACT, they were the subject of a webinar we held last week. We also developed models for those. They're separate models, and they were covered in a previous webinar, but they have comparable reports. So there's 4 materials altogether that you can view, 2 for HM, a report and a brief, and 2 for RF, a report and brief that discuss these models. But today, we're just focused on the HMRE programs. And in PACT, there were 2 main study components. There was an implementation study that documented all the process of program operations, and then a study of impact or program effectiveness. Also funded through the PACT evaluation are several special topics reports, one of which is what we're discussing today, which is the Pathways to Outcomes models. Our main goal for these Pathways to Outcomes models was to develop something that visually depicted how program activities may contribute to their intended outcome, and specifically for adult couples. There's a couple reasons that we're focused only on adult couples, mainly being the program, HMRE programs have been couple-focused for quite some time now, so they have the largest body of research associated with them. There are programs for youth and adult individuals. They've been around not as long as the couple ones. So those are not the focus of today's webinar, although they are being served by current programs. So the Pathways to Outcomes model have two objectives. So they're really overall intended to advance the field of HMRE programming and research. And they do that by depicting evidence-informed hypotheses that practitioners can be used to can use to guide the design and actual implementation of their program. Additionally, researchers can actually use them to develop some specific hypotheses that can further the research and contribute to the evidence base around these programs. And as I said before, we have separate models for our HMRE programs for couples and for RF programs. So what was the rationale for these models? There's a plethora of research, a large body of research on HMRE programs. That started, early 90s, so it's been around for a while. But what we see are these mixed results. We see some negative effects, some null effects, which is no significant changes, and even positive effects. They're kind of across the board. There's significant evidence that these programs work, but it's not every research study finds that. And on top of that, few studies have examined the sequencing of short-term to long-term outcomes, meaning how should outcomes play out and influence each other. And I'll talk about that a little more in the presentation later. But because there's been little exploration of how the outcomes should unfold, that might contribute to some of the inconsistent results that we see. Furthermore, all of the federally funded big evaluations focus on overall program effectiveness. How effective was that program at changing something about couples or families? They didn't really focus on the specific activities within and how they could be linked to outcomes. So that's where these models come in. So we're looking to link those activities or provide hypothesized links of activities to intended outcomes. And as I hinted at previously, they have two audiences: HMRE grantees or program practitioners that can use these to help guide and carefully consider activities that they're implementing or wish to implement to achieve their intended outcomes. And then those researchers that can take these models and look at where they can form specific, very testable hypotheses to make sure that all of our assumptions and our hypotheses are accurate. I'll delve right into methods. I'll preview that we had a very comprehensive set of activities. I'm going to provide high-level overview. There's much more detail in our report, and happy to take questions about methods at the end if there are any. So we wanted to identify programs that participated in multiple federally funded experimental evaluations of HMRE programs. So experimental means random assignment, that participants were randomly assigned to a treatment or a comparison group. And we identified 3 programs that met that criteria. And the 3 evaluations, the 3 federal evaluations, were the Building Strong Family Evaluation, or BSF, Supporting Healthy Marriage, or SHM, and of course, PACT. And we had 3 programs from all across the country. We had the HOME program operated by the El Paso Center for Children in El Paso, the Supporting Healthy Relationship program operated by Universal Behavioral Associates in the Bronx in New York City, and Family Expectations operated by Public Strategies in Oklahoma City. And these all participated in some combination of 2 out of the 3 evaluations that I just discussed. We started with these programs, and we called together all of the federally funded reports on these projects. We looked at implementation reports, qualitative study reports, impact study reports, and their technical appendices. And we identified all the activities that these 3 programs were conducting, all of the contextual factors, so that's the community factors in which they operate, the characteristics of the participants that they serve, and organizational factors as well. And then we looked at the range of outcomes that each of these studies were examining, or each of these large-scale evaluations were examining. And in terms of outcomes, we used the underlying theory specified by several researchers. I've put a citation there for anyone that wants a good primer on some of the theoretical underpinnings of HMRE programs. But we use that to classify outcomes into short and long-term outcomes. So researchers currently theorize that participating in HMRE curricula or programs should lead to short-term skill or knowledge gains. So if I participate in an HMRE program, I should leave that program with increased communication or conflict management skills and an increase in my healthy relationship skills. So things like building trust, building emotional intimacy, things like that are my healthy, knowing what a healthy relationship or a good relationship should consist of. Now, all of these skill gains in the short term should lead to better, what we call couple functioning outcomes in the long term. So those things are improved relationship satisfaction, greater relationship stability, prevention or reduction of intimate partner violence, and improved co-parenting and parenting style. So those are longer term outcomes. I should note that programs and these federal evaluations measured more than these couple functioning outcomes. They measured things like change in employment, income, child well-being. However, the couple is the main focus of HMRE programs. And we'll talk about the curriculum that they commonly use. But that's the main mechanism through which programs operate. It's at the couple level. They're trying to improve the romantic relationship between two partners. So we didn't include all those other outcomes here. You have to include another set of activities, but this is really just focused on improving that couple level outcomes. So as I hinted, we had a very comprehensive process shown here in our flow chart. So we reviewed all that documentation from the federal evaluation, and we developed program-specific models that depicted the specific program activities from each of the three organizations we identified, their individual contextual factors, and then a summary of their outcomes across the evaluation, the evaluations they participated in. And we took those to several researchers in the HMRE field to get their feedback on it. And researchers liked these more summary models of all the research on these three, but thought that a more general formative model might be better. So something that could be more adoptable by other programs other than these three organizations that we selected. So we consulted with Kriti and Kathleen and others at ACF and agreed with the researchers, and then began developing these more formative models that had hypotheses that linked the activities to the outcomes. And so we developed those models, and we took them to HMRE practitioners, people with current grants that were operating programs, and incorporated their feedback. And then we did a very targeted review of the peer-reviewed literature. Although it was targeted, it was very thorough, so I won't go into all the results here. Happy to chat about it with anyone afterwards. They're all published in our public report. But we reviewed a good number of articles to either support our hypotheses within each model or refute it and have some revisions. After consulting with practitioners and consulting the literature, we again revised the models and the hypotheses, and then went back to our practitioners and researchers to get their final feedback. And what we'll present to you is the final models from this very comprehensive and collaborative process. So we'll get into the meat of today's presentation, which are the models themselves. I just want to note before we get into these, I want to talk to you about what you'll see and how to read them, because you're going to see a lot of information. We're going to cover a high-level portion of that, and I encourage you, again, to go to the reports or the briefs when they're available and look at these more in depth. But this is generally what you'll see. You're going to see a gray box on top with activities and some outcomes and influences factors. So up at the top, you have the hypothesis for each model. So this is just a summary statement specific to the model that, again, links the activities to the intended outcomes. Below the hypotheses, you'll see the activities. And this covers everything that grantees might do, from the design stage to implementation and the support, to support the delivery of their services. In the middle here, you have what we call in our report the intermediate participation outcome. We know that high levels of participation are needed to achieve outcomes. So therefore, from activities to the outcomes, we want to see high levels of participation for couples to really experience the benefits of the program. And then we have our short and long-term outcomes that I covered previously. So again, short-term outcomes are our conflict management and healthy relationship skill gains, and longer-term outcomes are those couple functioning outcomes like satisfaction, stability, co-parenting. And down below, we have what we call influence factors. So part of what we did in our review is we looked at our community factors, our individual and couple level factors, our larger policy context or organizational context, and we listed those factors that might be relevant to this specific hypothesis. So those are found at the bottom of each model. But before we dive in, let's talk about what these models can and can't do. So remember that they're formative. They're looking at hypothesized links between activities and outcomes, which means that they're not causal. They're not meant to say that these will get you to where you need to be. We're saying that they might. So in that instance, they are very evidence-informed, but we wouldn't call them evidence-based because there's no causality. As we said before, these are meant to guide researchers and practitioners. So hopefully researchers can take these models and test these hypotheses and either confirm them or suggest further revisions to what these might be. And the same with practitioners. When you look at these models, you're going to see a lot of activities, a lot of influence factors. But you need to be cautious in applying anything new to your program. You have to carefully consider the individual context of your program, your target population, to think about if adding this service or this feature is truly right for your program, remembering that these are hypothesized links, not causal. Another really important caveat here is there's probably more activities, more outcomes, more influence factors that you might capture. We were thorough, but we weren't exhaustive. Our literature review was targeted. So we definitely didn't capture everything that could lead to these intended outcomes. So there is more out there that you might have to consider, particularly when you get into that individual context of your program. All right, let's get right into our models ourselves. So we have 3 models we're going to cover today. And this first one focuses on delivering the curriculum. So I know this is a very dense slide to look at. You do not have to read all of this. I'm going to break it down for you a little bit. And we can also show it at the end of the presentation if anyone has questions about it. So this first model focuses on delivering the curriculum. The curriculum is generally the central feature of nearly all HMRE programs. It's a core workshop that the couples participate in together and is the main driver of changes that we expect to see. So that's how they're getting these skill gains, is through the curriculum. So this hypothesis states couple functioning outcomes may improve through program selection and implementation of HMRE curriculum. By selecting HMRE curriculum that is 1, evidence-informed, 2, is intended for a clearly specified target population, and 3, includes adequate time to deliver the intended content in a group format, programs may improve outcomes related to couple functioning. Additionally, the implementation of the curriculum by program facilitators may influence outcomes. Curriculum delivered by qualified, well-trained facilitators who are supervised to ensure the curriculum is delivered with fidelity may improve outcomes related to couple functioning. So that was a very long-winded thing to say to get to that basically you need to think carefully about your curriculum, and you have to have good quality facilitators that can deliver it. And so we'll break that down a bit for you to those different pieces. So the first thing to consider is the curriculum. And one thing specified in this model is that programs might want to ensure they have a very thorough definition of their target population, understanding who they're serving, why they're serving them, because this can later help you match up the right curriculum to the right target population. Are you serving step families? Are you serving blended families? Are you serving racial or ethnic minorities? All of these things matter in terms of your curriculum choice. So understanding that's the first step. Second, select a curriculum that is evidence-informed or has an evidence base for changing what you'd want to see, meaning that you should select a curriculum that has some evidence that it's going to change those skills, those conflict management and those relationship skills. And then have some evidence, too, of changing other long-term couple functioning outcomes. So it should have that evidence base associated with it. You also want to make sure it's specified for your target population. That's part of that mapping out that target population. So you can make sure you're doing that and making an informed choice. And then the third bullet here talks about what we call dosage or hours of curriculum. So there's not a lot of research on the perfect amount of dosage. We talk about that in the report. I'm happy to answer more questions about that at the end. But in all of the federal evaluations, programs had at least 18 hours of content that was delivered in a group format. So that's just an important and very a poignant thing to test in the future. Also, facilitators, you've got to consider who's delivering the program. You have to think about not only the facilitator's academic or work experience, but also other demographic characteristics. Do they resemble the target population? Can they connect with them? All those things might influence how people perceive and absorb the content. Additionally, you have to train the facilitators. The obvious training, of course, is training on the curriculum, but you need to provide training on facilitation skills. You want that curriculum to be delivered in a quality way. So there is some additional training you might need to facilitate that. And finally, regular supervision is a good idea with facilitators. Not only does it assure that quality perspective, that it's being delivered in a way that's meaningful to the participants, but it also serves as a fidelity check. Is the curriculum being delivered as it was intended by the curriculum developer? So finally, down at the bottom here, we have several influence factors. We have a variety of individual and couple characteristics that all, there's probably too many to list here, but they all play a part in selecting that curriculum and understanding your population. And then there's some community and policy contextual factors that are important to point out. Things like unemployment rates, or the availability of potential employees, all influence the quality of facilitators that a program can grab, or the quality of supervisors. And additionally, dissemination efforts about evidence-based curricula or training. How is that information getting to the grantees to select what they should select? All those play an important role here in finding a curriculum and delivering it. The second model focuses on that intermediate participation outcome and really is about maximizing participation. So you're enrolled. We want to get you from enrollment to completing and getting as much of that curriculum as we possibly can, or as much services as we possibly can give you. So this hypothesis states increased participation in HMRE curriculum workshops may improve couple functioning outcomes. Programs that select and implement retention and barrier reduction plans that include 1, case management services, 2, participation supports, those are incentives, childcare, transportation, etc. And 3, flexible workshop scheduling may increase participation, which in turn leads to better couple functioning outcomes. Staff implementing the retention and barrier reduction plan May also consider building staff and participant relationships and rapport and relationships between other participants as a means for increasing participation. So you'll see here all the activities are associated with getting you to come regularly and consistently. So that starts with just case management. And what we observed through our data collection is that programs often do needs and strength assessments and develop individualized service plans. So they're looking for those individual barriers at the individual or couple area and helping couples address them so that they can regularly attend. Additionally, if a case manager can't address those barriers, they might provide a referral to a partner organization or a referral network that can help a participant address those barriers to attendance. We then have a range of participation supports. Most common, cash incentives linked to participation milestones. Those definitely range across different programs, but it could be something like a $10 gift card for attending your first session, or another gift card for completing everything or attending a certain number of case management sessions. People also provide meals or childcare on site, as well as transportation assistance to and from the workshop. And that could be personal transportation like a shuttle van that a program may own, or taxi vouchers or bus tickets or things like that. There's also a scheduling aspect. A lot of programs talk about providing a flexible schedule that can meet the needs of various couples that they serve. So making sure that your schedule aligns with the people that you're serving. And finally, there's this importance of building relationships. So staff should aim to build relationships and foster an environment that is trusting and supportive and keeps people coming back. And within the workshop, there's elements of group cohesion or peer interactions or developing a peer group. That's an important part of a lot of these group services, is fostering that network among the participants so they feel supported with each other. And something we noted throughout our data collection efforts is how staff might do that. That could be through regular reminder calls or just simple check-in calls to check in not only on their needs and barriers, but also remind them about their upcoming session. Finally, we have mostly individual and couple characteristics. These are all associated with what you might expect needs or barriers to be focused on, things like employment status, educational attainment. We might have physical or mental health issues, things like that. And also in terms of the community influence factors, things like transportation. Are you in a more rural area? Are you in a more urban area? What's the availability of that public transit? That influences the types of supports you might supply. Or even unemployment rates might influence the level of needs that your current target population is facing. All right, and our final model here is about addressing influence factors. So this is sort of pulling all of those participant influence factors together and figuring out how programs address them across their program overall. So this hypothesis states HMRF programs that account for or address potential couple level and individual influence factors such as relationship distress, commitment, race, ethnicity, and or economic disadvantage may be more likely to improve couple functioning outcomes. Programs that consider how couple and individual characteristics affect all aspects of their program activities, from recruitment to curriculum to partnerships, may be more likely to engage their target populations and have services more relevant to their lives, which may lead to increased participation and better couple functioning outcomes. So here, we're really looking at the program soup to nuts. We're looking at it overall. Where can we plug in individual influence factors or couple level to make it more relevant to address potential needs. There's a couple places that we can do that I'll highlight right now. And the first comes back to recruitment. Step one with that might be ensuring that the program has a thorough definition of their target population. That drives so much. Understanding who you serve and why you're serving them helps you in a lot of ways, or can potentially help you in a lot of ways. Then selecting those recruitment methods or forming recruitment partnerships that helps you identify that target population. So finding the people that you want to find that will be most interested and benefit the most from your services. We're going back to HMRE curricula here again, incorporating aspects of that first model. So selecting that curriculum that's designed for your target population. Or identifying places that it needs adaptations, where you'd work with somebody like a curriculum developer to make those adaptations so that the content of the curriculum or other program services is more relevant to who you're trying to serve. Model number two, bringing aspects back in here. So case management, providing that case management to address the unique needs and barriers of the target population. What do you need to provide them? What do your case managers need to give them? If you can't meet it, can you form a partnership that can meet that unique barrier? Or perhaps providing a service that your grant funds can't. For example, in many ACF programs, like HMRE, you cannot use grant funds to pay for counseling services. But you might have a community partner that's funded privately and can provide those services, and providing that through a different mechanism. So finding mental health services that people might need through partners, through a different revenue stream, might be a way for you to address those needs and address those influence factors. Relatedly, too, is thinking about what supplemental services you can offer as a grantee. So if rates of unemployment are high, do you need to add an employment component to your program? How you do that, what kind of employment program depends on your target population. Also, your ability to incorporate one. You might not be able to. So again, going back to those partnerships, how are you developing your partnerships? Who are you selecting to help address those unmet needs through other supplemental services? And then we have a host of couple and individual characteristics down at the bottom. At the couple level, they're all things that might influence needs. So number of children that you have. Do you cohabitate with your partner? What's your relationship history? How stable is your relationship? Do you have support from your family and friends network as a couple? Also, individual characteristics. Things like educational attainment, employment are obvious, but also thinking through criminal justice involvement, your values, your trauma history, what was your childhood like? What other things might you be bringing into the program that they could help you address? So a host of influence factors at both levels, both individual and the couple. So this is our last model, and before we get into questions, I just want to note that you'll see in this model, we're starting to pull some threads of previous ones in. And I think it's important that you can look at these models siloed, but ideally, you'd look at them together and assess your program as a whole, remembering that these are not causal links, that these are formative and hypotheses. But you'd look at them together and consider the overall context of your program and how these models can work together to fit and enhance your program. So we'll start our Q&A now. Again, you can use the widgets on the bottom to submit your questions, and Scott will read some questions aloud in just a second, and I'll answer those. But to give you time to type, I'll just put some references up. As I said, our full report on these models is now available. That specifies everything from our motivation to a thorough description of our methods and an actual discussion of the models in depth. And a brief that's a little bit more practitioner and researcher focused is forthcoming. We obviously don't have a link or a site to that yet, but it is being published soon. And finally, if you want any more information, you can contact our project officers, Kriti Jen or Kathleen McCoy. You can also contact myself or our project director, Heather Zaberi, if you have any other questions. All right. Great. Scott, do you want to?
Yes. Hi, Dan. We have one question so far from Bill Coffin at the Institute for Family Studies. And he asks whether another way to increase participation is by using a practical, useful curriculum that's occasionally fun. Therefore, couples feel that the workshop is a good use of their time. I'm wondering if you want to react to that idea at all.
I think that's a good example of that Bill's bringing up there of something I touched on earlier, right? This is an exhaustive list of everything your curriculum needs to be, right? You don't want to select a curriculum where someone's reading from a book the whole time, because I agree with you that people aren't going to like that. It won't be a good time. So there are some other aspects that you need to consider in your curriculum, and things like how many activities? Are they good activities? Are they relevant activities to your target population? So I think those are all things you can take some of these components, like a thorough definition of your target population, and say, hey, are these really fun for this target population? Or are they kind of tone deaf, right? So I think you're absolutely right. And the other part of having fun activities is how the facilitator delivers them too. So you definitely want a facilitator that is fun and engaging where they need to be. So I think you're absolutely right, Bill.
We have a follow-up question. Can you specify the curricula that were used, and were there specific objectives, and were they measured?
I'd have to go back to the specific reports. Off the Supporting Healthy Relationships uses the LCLC curriculum. That's the one in the Bronx. And the home program uses the Within Our Reach, I believe. And then Family Expectations, I think, used the Becoming Parents program. Again, I'd have to confirm those, but off the top of my head, that sounds right. And in terms of the specific objectives, there were specific objectives for each of the federally funded studies, but in terms of, the specific curriculum components, that's where, when we go back to the objective of the federal studies, it was measure overall program effectiveness. So if there was something that a specific curriculum teaches, it wasn't necessarily measured in the program effectiveness portions, because it wasn't designed to get at the different activities that they were doing within that curriculum. Great. Well, thank you all for joining. I appreciate taking time and listening to me today. As always, I will put up our slide here again with all of our emails. We are free for any other questions that you might have. Please go and download the report that contains the models and watch for our upcoming brief. Kriti, any final closing thoughts?
No, nothing else for me. I thought this was great. I think there might be one last comment that came in, but otherwise I'm good.
Oh, sure. I just see that now. So it's more about the 18 hours. Yeah, so I can do that. So, I'll say that there's probably one or two articles talking about how many hours or what hours translates to for in terms of outcomes. And those are linked in our report. So we don't know much about where the sweet spot is for the total number of hours. The suggestion in our hypothesis for 18 is that that is the minimum that the three programs offered in the evaluation. So they offered a minimum. Some offered longer, but they all offered at least 18 hours. So we're just going with this minimum as a suggestion. This in particular needs a lot of research and a lot of thought. We don't know what the right amount is for anybody. So if you're looking for a good area to investigate, this is prime here. But if we're just going off of the programs in these experimental evaluations and to achieve the effects that they got, that would be where the minimum comes in. That's the cutoff if you're looking at it from that perspective. Right. Well, please follow up with me or anyone else if you have any other questions. And thank you all for attending today. I appreciate your time and attention.